It is time for a little detective work now, some medical sleuthing with Call of the Week, as we take a whole bunch of symptoms and get to the bottom of what the possible cause could be just by listening carefully, asking the right questions, and overall by just being clever, which Seta is so good at being clever.
Medicine's own Sherlock Holmes and Watson. Aches and pains are a common problem, and we experience a few through our lifetime. We had a call this week from Dave. He's a recently retired accountant who's living the good life in Stellenbosch.
Lucky Dave.
He came and he's calling complaining about the fact that he's got sore joints, more especially his left knee and ankle over the past 24 hours.
Interesting. Now, joint pain is really common, and unfortunately, as we age, we get more than just grey hair. We get a lot more pain too. Of course, it doesn't have to be like that. A healthy lifestyle goes a long way in keeping joints fit and flexible, but that's maybe a discussion for a different day. Getting back to the call, I'm off my soapbox.
Please, can we get back to Dave? I'm actually going to do what you normally do and give us a list of common conditions. So it could be either rheumatoid arthritis, osteoarthritis, septic arthritis, an infection in the joint itself, tendinitis. It could be due to gout, or someone has got a bout of flu, or an injury, so such as falling, a sprain, or a strain.
Okay, that's quite a list. I'm impressed. Well, you'd have to ask a couple of questions around his medical history. I mean, for example, for a tendinitis or an injury, any sporting events or any kind of falls off ladders, anything like that?
Well, when I asked about his sporting history, he had a really good laugh at my expense. And he said he is, after all, an accountant.
Oh, we can't say that. I mean, that's insulting to accountants. Accountants
I told him
exercise.
that's no excuse for him not to be doing any exercise. But he assured me he hasn't suffered any falls or injuries recently, which could make him have that joint pain.
Okay. Was he feeling fluish?
No, when I asked about flu, he assured me he has his jab once a year, and he hasn't experienced any flu over the last year or so. And he seems quite good at telling the difference between a joint ache and pain and a muscle ache and pain. So he's quite sure he doesn't have the flu.
Okay, I'm impressed that he gets the jab all the time. So what are we left with?
So we're left with rheumatoid arthritis, osteoarthritis, septic arthritis, and gout.
Okay, the itises and gout. Cool. So obviously some form of arthritis. Often people don't realize though that gout also falls under this umbrella term. So you needed more specific information to understand what the underlying cause of his pain could be.
Yes, no, of course. But he says that besides the pain in the joint, he wasn't feeling unwell though.
Okay, well that rules out septic arthritis, because if you've got that, you feel awful. In a case like this, it would have been important to refer him to a doctor immediately, with septic arthritis, of course, to make sure the infection that was causing the pain didn't spread anywhere else, because that is serious.
No, that's true. I was able to eliminate the osteoarthritis as well, because his pain went from 0 to hero in just 24 hours. He also told me that the ankle felt hot to the touch and that the knee looked puffy. So now you have to now try and find the difference between the rheumatoid arthritis and the gout, which is difficult because they're very similar in their symptoms.
In many ways, you're right. The puffy knee, as they say in French. Well, while rheumatoid arthritis can affect anyone and anywhere, it's most apparent in the hands and occurs almost twice as often in women. All right, so rheumatoid arthritis. Gout, on the other hand, is a man's disease. Not quite as serious as man's flu, of course, but it does occur almost 10 times more often in men than women. It's also very common, making it the most prevalent form of inflammatory arthritis in men over the age of 40. And it's easy to spot if the pain is in the toe, but it can occur in any other joint as well.
You are forgetting one critical factor though. He just recently moved to Stellenbosch.
Stellenbosch,
famous wineland. Exactly.
Nice.
So when
Good
I
word,
asked
wine.
about his dietary habits, he admitted quite sheepishly that he has been partaking a lot more wine tasting recently.
Okay. So, Dave, alcohol associated with an increase in uric acid, which underlies gout. But it isn't the only factor at play. In fact, a study recently showed that 2 or more soft drinks a day increased gout risk, listen to this, by 85%.
That's quite high. So it's overall nutrition, medications such as antihypertensive or diuretics, and also the genetics also play a role in whether you develop gout. So I sent him to his GP, who did the uric acid levels in his blood tests and put him on a treatment plan.
Well done, Dr. Chume. No doubt he's feeling a whole lot better already and may think twice about his next wine tasting outing. Hard though, Rooi wyn is wonderlik.